Okay, we are live on YouTube. UGTV will be starting here in just a second. Carol, I have restored host privileges back to you.
Thank you.
I need about 10 more seconds for UGTV. Okay, we're live on both fronts.
Good afternoon. Before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely as well as on site. All participants joining by phone should mute their phones when not speaking to avoid background noise. Please make sure during the meeting, announce yourself by name and title every time you speak so the public that is participating knows who is speaking. This is critical given the number of remote participants and its current guidance from the Kansas Attorney General. I'd ask the clerk to announce the meeting and call the roll.
Good evening. You are hereby notified that I have called a special session of the Unified Government of Wyandotte County, Kansas City, Kansas to be held Thursday, March 11, 2021 at 5 p.m. for a COVID update via Zoom. Immediately following will be an executive session regarding labor. Roll call. Walters.
Here.
Philbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Townsend.
Here.
McKiernan. Ramirez. Johnson.
Here.
Hain. Here. Markley.
Here.
Albee.
Here. All right, thank you. Tonight we have a COVID-19 vaccination update. I'll turn it over to Mr. Bach to introduce staff.
Thank you, Mayor, Commission, members of the public. So tonight we want to go through and give you an update of where we are with COVID-19 and our vaccination efforts. I will state in starting this, there is much out there about the American Rescue Fund. This is not an update about that. We are still just getting the bill and starting to sift through the 500-600 pages worth of information that's in that bill to figure out just how that'll work, how it'll apply. We do know we're going to get a nice allocation that comes back to us that we can spend over, it looks like a couple of years to come into it. There are a lot of restrictions to it, so we're getting a full understanding of that. So tonight is not about that. We are here to hear from our health department teams on one of our updates is where we are. So with that, I'm going to turn this over to Julianne Van Loo and the health department team. Julianne?
Thanks, Doug. Good evening, Mr. Mayor and Commissioners. Thank you for having us back to give you a COVID update. Tonight with me, I have Dr. Alan Greiner and Dr. Erin Corvo, our health officers, as well as Elizabeth Gronway, our chief epidemiologist. We are going to go ahead and swing to Dr. Greiner for our situational update. Go ahead, Doc.
Thanks, Julianne, and thank you, Mayor, Commissioners, members of the public for having us. We got what I think is good news. We are seeing light at the end of the tunnel. We're going to tell you some about that. We're all nervous that there could still be bumps and problems, and we know our community is still vulnerable. But as many of you know, things are really looking good. It's been a year. Many of you remember this day a year ago, and it's been dramatic. 365 days in a row now ever since then. We've had, over 11% of the county test positive. So over 17, almost 18,000 confirmed cases and probably another 1,500 that are probable cases. Of course, there have probably been a lot more that we didn't get tested out there. I think one of the things we can be really proud of is the death number stalled. As things begin to improve in terms of therapeutics, as well as I think overall, change in people's behavior, we really slowed that down in the last 5 to 6 months. So we only have had 178 deaths, and like I said, 11% positive approximately. The rolling day averages are really the thing that's encouraging. We're down to 13 cases a day on a 7-day rolling average, which is a number that I don't think we've seen in 10 months or so. And we've gotten the positivity rate. It's dipped below 10, but just being down at 10 is really comforting and I think an important milestone to us because we were in the 20s and 30s, as you all know, for months and months and months in terms of our test positivity rate. We know we have to push that down further. The state positivity rate is down to about 3 right now, which is really great. And I'd like to see us get there in the coming weeks as well. This just shows you the trajectory of the pandemic over the last year. And you really get a sense of the spikes we saw and how much improvement we've seen here recently. There are people that worry a little bit about a fourth wave or a fourth spike or even a plateau that causes problems. But we're going to keep fighting to push vaccine. And so I think that's it for me. I'm going to turn it over to Dr. Corvo, who's going to talk about new orders, and then we'll get into vaccines and other things. So Dr. Corvo.
Thanks, Dr. Greiner. Good evening, everyone. Just want to discuss a couple changes in health orders that have come out. Actually, today we released a new school order. Our goal is to get more and more kids back into the classroom. So we've continued to work very hard with our superintendents and school leaderships, as well as school nurses to make these changes. We're still going to be requiring masks at all times during school. We are going to allow middle and high schoolers, however, to be in the classroom with just 3 feet of social distancing. So that is a change from the 6 feet that we had laid out in orders prior to this. Our elementary students are allowed to sit together at the same table. That is including 4 or 5 kids at the same table. We're calling that pods, and they're remaining in the same classroom. But for our middle and high schoolers, we're allowing them to make 4 different class changes during the day. And I think our school leadership is pretty happy with that. In terms of sports play, not too long ago, we released a fairly new sports order that gave both schools and organizations options in terms of mask wearing during sports play. One option would be to wear masks during practice and play. If the players are not regularly testing for COVID-19, we recommend that as best practice. However, an option that we've given to schools is to test players on a weekly basis, and then within 72 hours of playing a team from outside of the county. And if we adhere to those testing regulations, we're allowing people to take, or students and players to take masks off just during practice and play. We expect them to be masked during sidelines and in the locker rooms and such. Band and choir, we think, poses a larger risk of virus spread and aerosolized particles. And so we're asking that masking take place even over the instruments, if that is possible, and over the folks who are singing as well. We think that's still important, as well as keeping an extra measure of distance. So we're keeping with our 6 feet of social distance there. But prior to this, we weren't recommending any band or choir happen. And so I think that that's sort of a new modification in our orders. Next slide, Julianne. We don't have any plans right now to relax our mask orders. We just have a very low percentage of our county at this point in time who have been fully vaccinated. So we think that this is the best practice. And so don't look for that to go away anytime soon. As far as social distancing, we still believe that that's the best guidance, especially for folks, of course, who are not in your household or people that are not in your pandemic bubble, as we've been calling it up to now. I do want to point out a couple changes that have come through the CDC recently that are important. First of all, I want to point out again that the definition of someone who is fully vaccinated is 2 weeks past either the second dose of their Pfizer or Moderna vaccine or 2 weeks past their single Johnson & Johnson vaccine. And once someone is fully vaccinated, the CDC put out a communication stating that, it's okay to visit with other fully vaccinated people indoors without wearing a mask or social distancing. We want to say that, yeah, that makes sense, but still be careful. And the reason is that we know that these vaccines are really effective at protecting us, you, from getting COVID and getting really bad symptoms from COVID. But we're still really learning a lot about how vaccines affect the spread of COVID-19. And so we're wondering at this point in time, and there's ongoing research as to, if vaccinated people can still spread the virus. And so if you're going back to a household or a bubble of people who are not fully vaccinated, even if you are, we want to urge caution and still say, hey, mask wearing makes a lot of sense. We've got variants now circulating in our community, and so we still need to take an extra measure of precaution until I think a larger percentage of our county and population have gotten fully vaccinated. Now I'm going to, I believe, swing to Elizabeth Gronweg, our chief epidemiologist.
Hello, everyone. So I wanted to give a brief update on testing in Wyandotte County. One of the real successes is how widely available testing is in Wyandotte County now. I'm sure a lot of us remember at the beginning of the pandemic how difficult it was to get tested for COVID. You'd have to find a place to go and there'd be long waits and the turnaround times could be days or even a week. And now the testing situation in Wyandotte County is much better. And testing is really very widely available for Wyandotte County residents. 2 of our vaccination sites are distributing CRL saliva test kits now, the Kmart location and the Best Buy location. We're also working with all of our school districts to offer expanded saliva testing in the schools, both for kids and staff that might have symptoms of COVID, as well as doing regular asymptomatic testing for students and athletes and band and choir students to really have a better handle on COVID within our schools. And we do also continue to partner with other agencies like Vibrant Health to offer testing on a pop-up basis and really make sure that testing is available quickly and easily for anyone in Wyandotte County that wants to get tested. Now, unfortunately, we are starting to see in the last month or two that testing numbers in Wyandotte County continue to drop significantly. I think that as people's focus shifts more towards vaccination, testing is less on people's minds, but testing is still very important. And we really need to see a consistent level of community testing so that we can accurately assess how much community spread is going on in the county and put any mitigation measures into place like contact tracing and quarantine and things like that to help continue to see those COVID numbers go down. So we really are continuing to encourage people to get tested. We're incentivizing some of our testing events through food distribution and trying to make it as accessible as possible because testing is still really important at this point in the pandemic. I'm going to turn it back over now to Julianne.
Thanks, Elizabeth. We'll start diving in now to our vaccine update. Just a little bit of a high-level reminder of the various arms of our vaccine strategy. The first, of course, is that our 3 mass vaccination sites are all up and running, which is fabulous. Our National Guard Armory site just launched a couple of days ago on Tuesday of this week with some great success. We have started providing weekly allocations to 2 of our largest safety net providers in Wyandotte County, Swope Health and Vibrant Health. They are working with us to vaccinate their high-risk 65 and older population, and that is going well. We do plan in coming weeks to expand the number of clinics that we're providing weekly allocations to so that this becomes more and more available in people's doctors' offices as we move through the spring and summer. Also a reminder that there is a federal pharmacy program. These 3 pharmacies we've listed here on the screen, the Medicine Shop on Parallel, the Hen House on Parallel, and the Price Chopper on State. Those 3 were all chosen at the federal level. We want to make sure people know we at the health department didn't choose those locations as the pharmacies to receive vaccines, and neither did the state. They were chosen at the federal level, and they are getting, it seems to be infrequent allocations. So it's a little bit hit or miss on whether or not they have a vaccine in stock, but we want to let people know that that is an additional option outside of the health department's vaccine work for them to potentially go online and find appointments through those pharmacies as well. Fourthly, we are deploying our vaccination drop teams frequently, several days a week now. We only have 1 vaccination drop team as of today. We are working on building a couple of other vaccination drop teams because the demand is really high. Right now, we're not able to provide that team to businesses who want it, to churches, and to a number of community partners who would love us to come on site to do vaccines. Our goal is to get there towards the end of the spring, where we could receive a request from a community partner, get something on the calendar, and get back out within a couple of weeks. But right now, that team really has to focus on our congregate care facilities. Today, they spent the entire day in the jail and vaccinated over 150 folks there, which is, of course, a very high-risk setting. So they have to be focused on those sites where people literally can't get to us. But we are very hopeful about what that vaccination drop team project will look like in coming months. And lastly, we have had a number of weeks of successful homebound vaccines. So that's a great option for folks who are bedbound or homebound and cannot get to us for health reasons. We've had a great success with our partnership with KCK EMS, so we thank them for their work with us. And we've just really had rave reviews from people who never thought that they would be able to get access to the vaccine for a really long time. So happy about how that project is going. In terms of supply, we are averaging about 3,500 doses of Pfizer per week coming in from the state. We have seen that, I was worried that was going to be a one-time bump a couple of weeks ago, but it's maintained, it's been steady for the last 3 weeks at this number, and it's what we anticipate receiving again next week. So having that be steady is very helpful in terms of scheduling and in terms of anticipating what coming weeks will look like. We have also received a couple of special allocations in the last couple of weeks. One, because we have a number of meatpacking folks in our community who are at a special high risk. We have vaccinated a lot of those folks, and we have also vaccinated a lot of our residents who work in meatpacking companies outside of Wyandotte County as well. So kind of a 2-pronged approach there. We continue to try to find these individuals, again, because of their very high risk status. And a lot of those workers are within our refugee population. So we are doing a number of special events for those folks, and we'll be doing some with our Latinx population as well. Again, trying to make sure that those places of employment are safe for people. And lastly, we did receive last week an allocation of Johnson & Johnson vaccine, which is fantastic. I was very surprised with how early we received an allocation of Johnson & Johnson, given it was just approved the week before last. The Johnson & Johnson really makes our ability to go on site much, much easier. So for example, I mentioned today we went to the jail and did those vaccines. We don't have to go back and do a second dose because we're doing Johnson & Johnson in these sorts of locations. And so that those Johnson & Johnson vaccines, we want to let people know, will not be available at our 3 mass vaccination sites because we need them to take on the road. Again, because not going back a second time means that second day we can deploy that drop team somewhere else. So it really increases the capacity of our drop team by virtue of being able to use the 1-dose vaccine in those locations. We will not be receiving another batch of Johnson & Johnson next week, but we anticipate the week after next, we hear that the state will be receiving a large allotment of Johnson & Johnson, and that we should receive a pretty decent allotment, again, week after next for more of our drop team sites. Going to pass it back to Elizabeth here for a few slides on how many folks we have vaccinated.
So I'm going to present to you all 2 distinctly different sets of data that we're tracking at the health department. So I want to make sure that people understand these are 2 different data sets. The first is people that have been vaccinated by the Unified Government Public Health Department at one of our vaccination sites. And these people, some of them are Wyandotte County residents, and then some of them are people that work in Wyandotte County. As you may recall, the earlier phases focused a lot on healthcare workers and teachers and other essential workers that might not live in Wyandotte County, but got vaccinated by the UG Public Health Department. And so at our vaccination site, we have administered about 21,000 first doses and about 15,000 second doses are completed vaccinations. And this graph here just kind of shows the timeline of first and second doses. And then the second set of numbers is Wyandotte County residents that have been vaccinated. And they may have been vaccinated by us at one of our vaccination sites, or they may have been vaccinated in the county where they work, or at a hospital, or at a pharmacy, or other places that are administering vaccine. But these numbers are people that live in Wyandotte County. And so we have about 9.3% of Wyandotte County residents that have gotten a first dose of vaccine, and 5.7% of Wyandotte County residents that are considered completely vaccinated, which is 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson. And this timeline shows that we are starting to pick up steam here with our vaccine administration in Wyandotte County. You notice that there are some dips in the chart, and those are weekends. And so we're hoping that we'll also be expanding to operate more on weekends and continue to get more doses out to the residents of Wyandotte County.
I did want to jump in here, Elizabeth, and note one thing, and to reassure folks that we are really honing in on our residents. So as we're vaccinating, for example, our 65 and older population right now, that is exclusively offered to Wyandotte County residents. So I expect to see these percentages jump substantially within the next 2 weeks as we really chip away at our senior population. And when we move into other sectors of the economy as well, we will likely be providing those just to Wyandotte County residents rather than anyone who lives or works here. Because we really do need to get this out into the arms of the people who live here.
Thank you, Julianne. And so this next couple slides is some demographic breakdowns of people, Wyandotte County residents that have been vaccinated. So this first graph here has a breakdown of rate per 100,000 by zip code. And later in the presentation, Julianne's going to talk a bit about our zip code prioritization and equity of vaccine distribution. As we mentioned previously, in earlier phases, we vaccinated a lot of healthcare workers and teachers. So the zip codes thus far have not been as equitable as we would like, but that's going to be a focus going forward. And Julianne will talk about that a bit more. And then here we have race and ethnicity breakdowns, rate per 100,000. Again, it's not as equitable as we would like, but we are going to continue to focus on this. We've got people that are focused on outreach to certain populations within our community that may be overlooked to make sure that everyone has access to the vaccine and that these rates are as equitable as we can. Finally, I wanted to talk a bit about our amazing volunteers. Our vaccination efforts have relied heavily on volunteers, and we're very thankful for all of the volunteers that have helped with our vaccination effort. It's a huge undertaking. And so we have over 500 volunteers now that are working all over the place at our vaccination sites and remotely. Over 1,300 shifts each month, and thus far 50,000 hours have been worked by our volunteers, which is a huge, effort for our community, and also saving the unified government a lot of money by relying so heavily on our volunteers. Next, I'm going to be turning it back over to Julianne.
Thanks, Elizabeth. And so the last portion here, we want to talk about where we are in our prioritization as we move through vaccines. I'm excited that we continue to get to add to our list of quote unquote completed groups in Wyandotte. Of course, they're never fully completed, but when we say completed, we mean that anyone in these sectors of the economy that have completed our online vaccine interest form have been contacted by us and given an appointment to come in and be vaccinated. So we continue to get, every day more surveys coming in, and as somebody in public safety or the food or restaurant business submits a survey, we continue to pull those and continue to prioritize those folks. And so there are small numbers from these sectors of our community still coming through, but by and large, we have conducted outreach to this entire list, which with some great success. We remain in phase 2. The state of Kansas remains in phase 2 as a whole. The governor made it clear in her visit to us on Tuesday that localities must remain in phase 2 until the entire state moves into phase 3. She estimates that around the first week of April will likely be when the state all transitions together into phase 3. So for phase 2, as a reminder, it's persons aged 65 and up, congregate settings, which we talked about, and a select list of high contact critical workers. So the folks that are eligible today, everyone that I mentioned as completed on the last couple of slides are still eligible. Again, we continue to vaccinate them, but we're very, very excited today to begin offering walk-in availability at all 3 of our mass vaccination sites for anyone 65 and older who lives in any zip code in our community. So we have worked our way through our zip code prioritization as pertained to 65 and olders. We scheduled everyone from that first tier of zip codes, that second tier. We're just about done with that whole third tier. We did a lot of electronic scheduling earlier this week with 66109 and 012. A lot of people were able to get appointments via text and email, which went very well. And so as we finished up that third group in terms of offering people appointments, we are now very excited to be able to provide this walk-in opportunity. So today, as I mentioned, was the very first day that we did this. It was a little nerve-wracking not knowing if it's going to be a couple people show up or a couple thousand. We estimate that we vaccinated about 400 people who just walked in today. I feel great about that at just having it gone to the news last evening, so not a lot of time for it to percolate in the community. We expect that kind of day over day, we'll start to see our walk-in numbers improve as the word gets out. So please share this with your constituents and your community members that, again, no appointment is necessary. We do need folks to bring something that demonstrates their age. So anything with a date of birth, like a license or a birth certificate, and something that shows that they're a resident. So that could be a government ID. It could also be a piece of mail with their name on it, whatever can show that they meet that 65 and up threshold and that they live here. We are also moving into appointments for additional high contact critical workers in phase 2. Right now, we're prioritizing retail workers by virtue of their necessity of being in person and in close contact with the people that they are serving. So we are actively providing those appointments as well. And then I mentioned the congregate living already. So excited about the 65 and up. Please spread the word there. We have a few remaining groups in phase 2 that we hope to get to as early as next week. So I mentioned we're working away on the retail appointments. We'll be transitioning to some of these other groups very shortly here. Private transportation of individuals. So these are our cab drivers and our Uber drivers and we've done most of our bus drivers, but anybody who's transporting people. The sector of agriculture, aviation, which includes flight attendants, stewardesses, those sort of folks, our warehouse workers, which we have a number in Wyandotte County. So we'll be opening up to them here in the next couple of weeks, and then our higher education folks as well. But as a reminder, we will be highly prioritizing Wyandotte County residents for these groups, again, to be really bumping up the percent of our folks who live here who have been vaccinated. Did want to do just a real quick reminder in terms of our zip code prioritization. So this doesn't apply when we talk about sectors of employment in the community. For example, right now, as we're offering appointments to retail workers, we aren't using the zip code prioritization. We're purely reaching out based on when people submitted the form to us. But as we move through our 65 and older population and eventually move into phase 3 in April, we will be returning to this. So as most of you know, we'll talk about phase 3 here in a moment, but that's largely folks with underlying health conditions. We will go back to prioritizing based on zip code. And again, that's because of the vulnerability of the folks who live in these zip codes, and also because, as Elizabeth showed you earlier, we do have inequity in terms of which zip codes have received more percent of vaccine for their population than others. So we're trying to really make this as equitable as possible, which is difficult to do. And we know that we can't make everyone happy, but it's our job as a health department for the county to do this as equitable as possible. So as I mentioned, we are likely to transition into phase 3 within the next few weeks, likely the first or second week of April. These are mostly people with severe medical risks. I put the list up here on the left-hand side. We will, of course, be abiding by KDHE's definition of severe medical risks, and that includes the risks listed here: cancer, COPD, chronic kidney disease, etc. We want to make it very plain to our residents that we will not be requiring documentation of these medical conditions. In fact, we have worked with the core 4 health departments and they have all made commitments. We have all made commitments to one another that across the metro, the 4 core health departments will not be requiring requiring documentation for these medical risks in terms of eligibility for phase 3. I think that's incredibly crucial for our population for whom access to healthcare is often a substantial burden and barrier, and we are looking to reduce that at all costs. So this will be on the honor system, and that will be tricky and a little bit difficult, but we will be asking people to self-identify appropriately in terms of their own health conditions, and we will be abiding by what they tell us. Also in phase 3, we'll move into these other sectors of critical infrastructure, people working in person, you can see here. So we'll finish up our government workers, transportation of goods, not individuals, technology, communications, construction, banks, and critical manufacturing. So phase 3 will really open up availability of vaccines for a number of folks in our community. That is all we have this evening. As usual, happy to take any questions. Thank you.
Thank you. Any comments or questions from the commission?
Mayor, I've got some questions. Julianne, it's Melissa Bynum. I've got some questions. There's a slide with a graph by zip code, and it says rate of people vaccinated by zip code. And I need to step back to that because I don't understand. What do the numbers represent?
So this is rate of people vaccinated by 100,000. So if 100,000 people lived in every zip code in Wyandotte County, here's how it would shake out. Does that make sense? So rather than just the number of people in each zip code that are vaccinated, that doesn't compare across, right? Because the size of the population of each zip code is different. So we use the rate to make it comparable. So when we use rate, this is how they compare to one another.
Okay, and it tells us what?
It tells us that 66109 and 66012 have received a larger share of their population being vaccinated than the other zip codes. 66103 is inching up as well, but you can see here that 66101, 102, 104, and 105 remain behind in terms of the rate of their folks that are being able to access the vaccine. So
and is this our own county health data, or is it regardless of where they got the vaccine?
Regardless of where. So this comes from KDHE. We finally were able to obtain last week anybody who put Wyandotte County as their county of residence when they were vaccinated, whether they got vaccinated in Johnson County or wherever, we are able to obtain their data since they're residents. And so this is everybody who lives here, regardless of where they got vaccinated.
Thank you so much. I have a couple questions on the phases and the categories within them. The pharmacies that have vaccine, am I correct? They're getting their vaccine doses from the federal government. Is that right?
Correct.
Those doses are not coming through the state of Kansas like ours are.
Correct.
Are they required to dose according to the phases?
They are. They're required to be within the phase. We really don't have a lot of way of making sure of that or any really stick, so to speak, in terms of adherence to that. So I've heard that by and large, they're vaccinating folks 65 and older, though I have heard that there have been younger folks who have been able to get vaccinated as well. So
yeah, I mean, I think we hear just kind of a whole variety of anomaly stories, anecdotally in the community. I mean, we hear them every single day. The subcategories that are in each phase, did the state create the subcategories or did we?
The state did. So for example, these other folks here in phase 2 that we'll get to when we finish most of our 65 and older, those were all chosen by the state. And per the state, we need to offer it to everyone working in these sectors of the economy before we move to phase 3.
Okay. And I drove by the Kmart location this morning at about 9:15 and it looked like the parking lot was absolutely packed. And I wondered, you made a comment earlier, but I was left with the notion that you would have given a lot of walk-in vaccines today, but did you say that wasn't the case?
Across all 3 sites, it was near 400. The Kmart did about 250 walk-ins. So.
Okay.
I'm actually not disappointed in that for just having it put out to the news yesterday evening. I really feel a couple days of word of mouth and we're going to see those numbers tick up.
Okay, thank you.
You bet.
Commissioner Johnson?
Thank you. Julianne, back to the numbers that Commissioner Bynum was alluding to. Those numbers in 66101, 66102, they kind of give me I think I heard from you all that we were putting special emphasis in those particular zip codes. So if in fact we did, why are we still seeing such low numbers in terms of vaccination? Or did I misunderstand that?
No, you did not. It is correct. We're still seeing these inequities across zip codes, even though we're trying to even them out. So one thing is that when we pull the vaccine interest form submissions, as we do every few days from our data set, when you look at it in terms of percentage of people from from each community that have submitted the vaccine interest form, 66101, 2, 4, and 5 have a lower percent of their community members that have submitted that form to us. So we're doing a number of things to combat that. We're hiring a small group of people who will be canvassing and going door to door in those zip codes in order to help people register for the vaccine on the spot and in fact schedule on the spot. We are also working very closely with a number of churches in those zip codes to get their congregation signed up as well. So part of it is that, we've done a lot of vaccines based on place of employment, and those places, those individuals live more often than not in 66109 and 66012, but it is also a self-selection thing where we're not getting as many people coming forward from some of the zip codes saying that they want to be vaccinated. And I don't believe it's because they don't want to be vaccinated. I believe it's because there's a lot going on and it's difficult for them to know what exact information they needed to listen to, how to use the online form, how to get there, how to get a ride, how to get time off work. So there are a number of factors here that are serious barriers for folks. And so our aim is to get more folks out into the community doing direct face-to-face education with people to help them understand what they need to do, that 311 is an option, that transportation is an option, that all these things are in place for them. But it's our job to get that information to them. So yeah, it remains very inequitable. We're very concerned about it, and we're trying to employ a number of initiatives to move the numbers in another direction.
Now, I guess the same would apply in the African-American community as well. And I think, and Alan, you may kind of chime in on this. There was some discussion about trying to engage those communities, but having lack of resources, at least initially. Is that a good understanding of where we are right now?
What do you mean by engage?
Going directly into those communities to, as you were talking about, knock on doors, getting them, signed up and things of that nature.
Yes. So as I mentioned, we only have the one drop team in place. We are trying to build 2 more drop teams as we speak. So we are currently actually very actively looking for 2 leads for drop teams. So if you know any health professionals that want to lead a drop site team in the community, we're actively looking to build up those teams. Some of the members of those teams will be employed by us or on contract, and then they'll be filled in with a number of volunteers. So we're working to get extra teams up as quickly as we can, because that's what will allow us to come to churches, to come to community groups and bring them on site.
And are we working with the Community Health Council and other like organizations to help to facilitate this?
Absolutely. So we're working in partnership with the Community Health Council to bring on 13 community health workers for whom this will be their primary responsibility to work on COVID kind of overall, but to especially push the vaccines. And that's by virtue of that CDBG grant that we were allowed to use those resources for that project.
Okay. All right. Thank you.
Commissioner, if I might add and maybe
Yes.
ask Ms. Van Lude to speak to the communications efforts, because there are also a number of communications efforts that are directly seeking to reach out to the community members and provide that information. So, Juliana, if you want to speak to that.
Absolutely. So some of you have probably started to see our PSAs on social media and on television. We've engaged with a number of media outlets for all sorts of things, including interviews, including spots with community members who have successfully received the vaccine. We are doing direct mailers starting next week to folks in the community. really, you name it, and we're trying to do it. I think the thing that we're doing most successfully is that we're starting to funnel information to community leaders in those communities that need to get it. So for example, Mungsana, who runs New Bethel Community Center, he is working with us to host a number of town halls with specific refugee populations. And so those sorts of things where we're getting the information to people who are trusted and can get that out to their community is really the heart of it. But we're doing a ton of paid media and really high quality materials as well. And then most of our materials at this point are available in Spanish at a minimum. We just pushed out our 65 and up graphic for walk-in in 9 different languages that we're hoping will make its way into different parts of the community. So really communications is at the heart of everything we do, because if people don't have the information, they can't make the choices that they want to make.
Bridget, do we have someone who has?
Mr. Mayor, we have Commissioner Townsend with her hand up.
Thank you. Commissioner Townsend?
Good evening.
Commissioner Townsend? Yes, thank you.
Thank you. Commissioner Gail Townsend, District 1. Good evening, fellow commissioners, and to the public. What a journey this has been in a year. And I just, again, wanted to acknowledge all of the hard work and the effort of our health department, Ms. Van Loo and Dr. Greiner, Dr. Corvo, our epidemiologist, Ms. Braunwig, any and everybody who's at the health department, any and every volunteer. Like I said, it's been a ride, and we know a whole lot more than we did a year ago. I do have a few particular questions based on 1 or 2 of the slides. And I'd like to see the slide again that had, let's see if I can get this, and maybe it's already up here. Yeah, the demographic breakdown by race. The last bar that shows the number 11,513 and the designator beneath it is 2 or more. What does that mean?
So when someone comes to the vaccination site and they fill out our very basic paperwork, which includes demographic information, they have the option of choosing 2 or more races. So someone could say that they identify as both Asian and as Black, or as both white and American Indian. And so that's up to their discretion, how they personally identify. And so if someone chose 2 or more, it's put into that category, since we don't want to assign them to 2 other categories. So it's
okay. All right, thank you. The other comment I had was that when you were discussing some of the barriers in the specific zip codes, and why, in response to Commissioner Johnson's question, the rates seem to still be pretty low. Those were a lot of basic concerns that hadn't even thought about as to why people in the 101, 104, 102 may not be coming in the numbers that we see in other places across the county. So I appreciate that this door-to-door approach will help not only inform people about how, when, and where they can get the vaccines, but also directing them to assistance to removing other barriers and concerns that they may have. Time off from work, transportation, all of that. So those are very real barriers. And it's not just that people in certain communities just don't want the vaccine. So I applaud your efforts to deal with that on that very basic level. So those are my comments. Thank you very much.
And if I could add one other thing as well. Julian mentioned earlier, we just opened our Armory location, which is our easternmost location, where those zip codes are going to have better access. So my hope is that next week, when my team analyzes this data again, that we'll see an increase in these zip codes now that we've got that Armory location open, which will help provide better access.
I hope you're right. I join you in that hope. Thank you.
Okay, thank you very much. That concludes the presentation. I will now entertain a motion for executive session regarding labor.
I move that the commission go into executive session until no later than 6:50 PM to consult with our attorneys and to discuss confidential matters regarding the status and future direction of labor negotiations as permitted under the Kansas Open Meetings Act, and that staff and outside counsel designated by the county administrator be present to participate in the discussion, and that if there is no further business, that we return to open session for the full commission meeting at 7 PM.
Thank you. Yep. We have a motion and a second by Commissioner Bynum. All those in favor say aye.
Aye.
Any opposed? All right, we will reconvene at 7 PM for our full commission meeting.